My name is David Rubin, and I am a Senior Co-Director for Policy Lab at the Children's Hospital of Philadelphia, and the first Only Center Fellow. I hadn't thought I was going to be a child abuse physician, but it made a lot of sense the further I thought about it, because it allowed me to stay rooted, I think, to the academic institution, to begin to nurture some of my interests around vulnerable populations, and so I made a leap of faith at the time and entered a child maltreatment fellowship at the end of my residency. And about a year in, I sort of said to myself, you know, I'm facing all these challenging questions, and I looked across the field of physicians principally who were doing child abuse work, and I realized there was a real lack of experience there for research and health policy issues for vulnerable children. Here I was diagnosing children and sort of handing them off to a child welfare system about which we knew very little in terms of their ability to help children. And the sense was that we needed to do a much better job. We couldn't just deal with the descriptive data, these data that we were presenting that were shocking people. We needed to start thinking about the interventions and engaging the stakeholders, namely the city and its behavioral health system and its child welfare system. We needed to change the landscape so families would have alternatives. Seesaw is a Children's Stability and Wellbeing project. We developed survey instruments that were driven around questions of placement stability and why agencies and caseworkers and parents have a hard time providing stability for children in foster care. What drives placement stability? Because if we know placement stability is important, what are the targets for intervention for the city to improve placement stability for children? We actually go out and visit with a child's family or caregivers every time that child changes placements to find out how the child's doing behaviorally, what other challenges they're having in the home. We speak to the caseworkers to find out how much caseworker turnover is going on and some of the reasons why children are moving. Our data, in line with a lot of other data that was provided to the leadership of DHS, has really been a driver to help them realize the importance of kinship care in the lives of children. It's really now leading to significant changes. What Stoneleigh has realized is that by providing a fellowship program, first of all, and providing money that really was flexible in terms of its, in terms of where the intention of where it might be used, permitted me as an investigator to be nimble, to have a little bit more of that unrestricted money as a fellow to apply as the needs came up, and that's allowed me, I believe, to be much more successful in terms of identifying targets for intervention and then starting to develop those areas. I look across this table at our Stoneleigh meetings, and I look at some of these fellows, and I realize in about 5 to 7 years, these are the people who are going to be the leadership within the city.